Hey you guys, for anyone that's watching this video and you have knee pain, please tune in to some of the things I'm about to say. My name is Dr. Kyle with ICE. I'm going to be going over a muscle that most of us probably haven't heard of, but is very important to the function of our knee, known as the popliteus. How the popliteus works, if you want to zoom in and check this part out, it's a small muscle that attaches to the inside of our thigh muscle and goes and crosses the backside of the knee to the opposite side of our shin bone. And what it does when it contracts, it will basically make the shin bone turn relative to the thigh bone at what we call terminal extension. So basically when your knee is locked out. So this is a really important muscle in the context of how we walk, because when we walk, we should be nice and fluid and taking a good stride with eventually a straight leg as we transition our weight. But the problem is if you have a popliteus muscle that's not functioning how it should, it makes this transition of a straight leg to eventually a bent leg and transitioning our weight a lot more difficult. So aside from the muscle, one thing I want you guys to keep in mind is that the popliteus is innervated by nerve roots that come off of the low back, specifically L4, L5, and S1. So anyone that is having knee pain, it's also really important to try and assess the function of the low back. Aside from those two components, the other thing to consider, part of the reason that I address these things as a chiropractor, is the structure of the knee itself. So aside from the function of the muscle and the innervation of the low back, sometimes the structure of the knee can be shifted in a way that we're not able to properly recruit the function of the popliteus muscle. Very often what will happen is what we call a posterior tibia. So if you can picture, this is the femur, which is the thigh bone, and the tibia, which is the shin bone. Posterior means it is slid backwards. So it will slide backwards like this. And even though there's nothing wrong with the muscle or the ligaments around there, because of this structure, our brain is not able to recruit that popliteus muscle, and it throws off the entire rhythm and cadence of our gait. So that's a big deal, and that's something that chiropractors can specifically help with. But I'm gonna give you a quick little tip that you can walk away with to address maybe a tight popliteus muscle or knee pain that you might be having. One thing you can do is you take a seat with a bent knee, and you'll find where that popliteus muscle belly is, which is typically on the inside of our shin bone on the backside. And what you'll do is take your thumb and pin it up against the backside of your shin. Then what you're gonna do is recoil your leg, turn your foot slightly in, put a little more pressure, and then you're going to straighten the leg as best you can while you hold that pressure. And then you're going to turn your foot out as far as you can as you continue to straighten it. So that's just one stretching rep. You can do that a couple times. I bet if you took 4 to 5 passes of that, you might feel like your knee is loosened up quite a bit, and that could significantly help with any knee pain that you might be having. So again, my name is Dr. Kyle with ICE, and thanks for watching this video.